Welcome to Facebook Live with Avant Healthcare Professionals, and I'm Shari Costantini. I'm CEO and founder of Avant Healthcare Professionals. And I'm coming to you today to give you an update on immigration under the Biden administration, as well as on the Healthcare Workforce Resilience Act. So under the Biden administration, we know that they've already proposed comprehensive immigration reform. And as part of that, there's a lot of benefit to availability of employment-based visas. It would really change dramatically the visa retrogressions that we routinely face now. So we're certainly supportive of a comprehensive approach. However, there has been no comprehensive immigration reform in this country for almost 40 years. So it is unlikely that we will get a big bill that will address everything. So what we think is more likely is something smaller than that, a small bill approach, and we'll talk a little bit more about that as we get to the Healthcare Workforce Resilience Act. Other good news is that the Biden administration has stopped the immigration ban for Muslim and African countries. So that went into effect in January. And so we're seeing exit interviews from Nigeria and other countries that previously had bans on them. And overall, we really anticipate a much more immigration-friendly environment. So more to come on that with the Healthcare Workforce Resilience Act. So this is a bill that was introduced in May of 2020. In December of 2020, we had elections that led to a new Congress. So as a result of that, a new bill would have to be introduced. But this bill had wide support from senators, both Republican and Democrats, as well as 80 trade and professional associations in healthcare. And what the Healthcare Workforce Resilience Act purpose was to enhance our nation's nurse and physician workforce during the COVID-19 crisis. And, you know, back in May when we introduced this bill, we thought it would have a relatively short window to get approved. But now, as we all know, this pandemic has continued on and most likely will be around at some point into 2022. So we expect the House and the Senate to introduce this bill, a version of this bill, in March and April. So stay tuned for more details on that. But I do want to just kind of walk through some of the provisions in this bill that are exciting for us. First of all, it authorizes a 25,000 visa recapture for nurses. And there's a 15,000 visa recapture for physicians. So what happens is that these visas are available to any nurses and any physicians regardless of the country of origin. So there's no per country caps, so to speak. In addition, immediate family members are excluded from that 25,000. So typically family members can be somewhere between half and 2/3 of all the visas used in the categories that nurses use. So that's more good news. This also requires the Department of Homeland Security, USCIS, to process visa petitions expeditiously. So now Avant Healthcare pays premium processing on all of our visa petitions, and they get approved in roughly 15 days. This bill requires not only the approval in 15 days, but then that they expedite those petitions over to the National Visa Center. And then from the National Visa Center, that once the U.S. embassies receive them, that that the candidates, the beneficiaries, and dependents have an exit interview scheduled within 15 days. So that's really great news, especially in recent months as we've scheduled to get plenty of exit interviews for our nurses. It does mandate that the employers such as Avant, attest that we're not displacing U.S. nurses with the nurses that are coming over on the visa petitions. So that's a small nuance to it. The original HWRA was tied to the presidential executive order and emergency proclamation related to COVID. And that does remain in effect, and there will likely be some tie to that in the new version that we'll see in the coming months. So, as we think about immigration under this Biden administration, as I said, we anticipate that it's going to be a more friendly environment. There'll be a new head of Department of Homeland Security, a new director of the USCIS, as well as Department of State and Department of Labor. As you may know, over the last 4 years, we have had challenges in all of these agencies. We have worked diligently with the USCIS to limit requests for evidence and denials. And in 2020, Avant had well over 1,000 visa approvals and only 28 RFEs. No denials. So that is a great track record and something every nurse that's looking to come to the U.S. wants to ask their potential employers. What's your experience with the USCIS? We had excessive delays with the Department of State, and Avant had to file an unreasonable delay lawsuit, which benefited our nurses by getting that lifted for them and expediting their processing at the U.S. Embassy in Manila. So hopefully we won't have these challenges with the new administration. If you haven't seen the Visa Bulletin update that's out on Avant's website and on Facebook, please take a look at it. It's really great news. It shows continued current priority dates for all chargeabilities, all countries other than India and China. So that is really great to see that in the employment-based third preference category. So look for that and look for continued updates every month from Avant on the Visa Bulletin. Know that Avant is constantly monitoring each agency and how it impacts the processing of your visa so that we can get you here as quickly as possible. We also work closely with our trade association, the American Association of International Healthcare Recruitment. And the next Facebook Live that I do, I'll talk more about that trade association and what it means to you as nurses that are looking to come with an ethical recruiter or staffing company. Thank you for tuning in to Facebook Live. It's good to see you all. I'll look forward to seeing you here in the United States. Thank you.